typically loud enough. Good morning. Thank you all for being here. I'm pleased to see you all survived the first day of the legislative session and decided to come back for the second. You know, there's already been a lot of discussion about Medicaid expansion in these past few months. And doubtless that probably pales in comparison to how much we'll be discussing all in these upcoming weeks and months. And I wanted to go into those discussions, though, with another perspective, one that really hasn't been either widely studied or widely reported. We know that Medicaid expansion has been a good deal for the thousands of our family, friends, and neighbors who now have access to affordable health care. Medicaid expansion's helped over 95,000 Montanans gain health care coverage. It's thrown a lifeline to our rural hospitals. It's slashed our uninsured rate by almost 2/3. We were 20% uninsured before Medicaid expansion, before the HELP Act passed, and down to about 7% today. It's the lowest it's ever been. It's also had a substantial impact on our economy. It's generated and sustained approximately 5,000 jobs, generating almost $300 million a year in personal income. And we're bringing those federal dollars back home. Medicaid expansion alone annually infuses over $500 million in healthcare dollars. We're helping our rural hospitals and our clinics not only survive, but thrive. States that didn't expand Medicaid have had a 6 times greater closure of rural hospitals than those that did. In Montana, we've not lost one rural hospital. Uncompensated care costs, which we know drive up the cost of health care for everyone, have decreased by 50% since we passed the HELP Act. And through that HelpLink program, what makes Montana's Medicaid expansion so unique and actually model in the country, we've set up a program to voluntarily match people on Medicaid with job opportunities, and also address the barriers that these Montanans may have to greater employment. As a result, that we've boosted labor market participation among low-income Montanans by 9%. We're the only state in the nation to see that kind of increase. And indeed, we know that in 2017, almost 7 out of every 10 Montanans receiving health care through Medicaid expansion were employed. Of those not employed, it's on your fact sheets, most are in school, receiving workforce training, or caregivers for a family member, or ill or disabled. Far too often, though, when we talk about Medicaid expansion, there are those who want to frame the gains to our state as benefiting just our doctors, hospitals, and healthcare community, or gains just to the 95,000 Montanans that are relying on us to continue access to health care. And there are those, including some in this building, who try to frame Medicaid as a giveaway to Montanans. Montanans that if only they were a little bit more industrious, or if only they showed a little bit more effort, they wouldn't need Medicaid. They could get their health care from their employers, or be able to purchase health care for themselves. I think that it's time that we finally fully recognize that the value of Medicaid expansion is as much for our Montana businesses as it is for the Montanans receiving health care. The report that we're releasing today, and it was prepared by the Departments of Revenue and the Department of Labor and Industry, found that workers who get their health care through Medicaid expansion, they're employed by 57% of private businesses in our state. In other words, in almost 3 out of 5 businesses in our state, those businesses rely on Medicaid expansion to provide health care for some portion of their employees. Montana Medicaid benefits businesses in every county, in every industry, and of every size. In President Sale's home county, over half of the businesses, 51.5%, rely on the Medicaid program to provide health care for at least some of their employees. If you went up to Speaker Hertz's home county, over 2/3 of the businesses, 67.3% rely on Medicaid. It's not a partisan issue. If you go to Minority Leader, Senate Minority Leader Sesso's home county, 64% of those businesses rely on Medicaid. House Minority Leader Schreiner's home county, 6 out of 10 businesses are employing at least one employee or more on Medicaid, 61%. And it's not an urban versus rural issue either. Golden Valley County, over 90% of their businesses have one or more of their employees on Medicaid. Indeed, in 2017, nearly 18,000 businesses had one or more employees enrolled in Medicaid Expansion. Let me say that again, nearly 18,000 businesses. Every county in our state had at least 30% of their businesses employing Medicaid Expansion participants. And this is the case for businesses large and small. 98% of businesses with more than 50 employees had at least one employee enrolled in Medicaid. However, most businesses employing Montana Medicaid Expansion enrollees were small businesses. It's also the case across business sectors. Nearly 90% of the employers in the accommodations and food services sector have employees enrolled in Medicaid Expansion. 9 out of 10 of those businesses rely on Medicaid Expansion, at least in part, to provide health care for their workers. Over half of construction firms in our state have at least one employee enrolled in Medicaid Expansion. 67% of retail businesses, including gas stations, had at least one employee in Medicaid Expansion. And perhaps, on the one hand, this ought to be common sense, or shouldn't be that surprising. Report also found that only 37% of our businesses in the state offer health care to their employees. We hear about the costs of this program to Montana. If employers had privately insured all those workers that received their health care through Medicaid Expansion 2017, the cost to those businesses would have been somewhere between $353 and $940 million borne by those businesses in 2017. The report also shows something that I want to be real clear about today, and most of those Medicaid Expansion enrollees, our friends and neighbors, they're working. We have that nationally recognized HelpLink job services program that's actually helping people who can find work, find good paying jobs, succeed in today's economy. We have the only program in the nation that demonstrated real results with increased labor market participation. Certainly, I'm willing to work with Republicans, legislators, to find common ground and to make improvements to what we know already works for Montana through that HelpLink program. But I'm not going to be supporting measures that take health care coverage from folks who can't meet a worker-hour quota that wouldn't pass muster in court, or that actually cost more to administer than it would be to be providing the benefits or health care coverage in the first place. Now, businesses are truly the backbone, certainly, of Montana's economy. Businesses and the workers at those businesses. And the report clearly shows that businesses large and small benefit from and rely upon keeping Medicaid Expansion. What this report truly does underscore, and it's time that our businesses also recognize that the choice we're making this session, either they can support the continuation of Medicaid Expansion for their employees, or they can face the reality that their employees will lose health care, creating a less healthy, productive, and reliable workforce. It's perhaps why it's no surprise that a statewide coalition of 6 out of 10 of Montana's largest local chambers of commerce, representing 4,700 businesses, have made the reauthorization of expansion, their top healthcare priority for this legislative session. So as we work together to continue to provide healthcare for 95,000 Montanans, let's not forget the larger impact also that this program has on our businesses in every county in our state, on the workers, and indeed on our economy. All that is at stake. Appreciate you taking a close look at the report. There's the summary of the fact sheet. Be happy to answer almost any question you might have on the report. Questions?
Governor, this fall, you told the Montana Association of Counties that if I-185 failed, those would be in for a tough session. You said, quote, if you thought the cuts last special session were difficult, I think you should brace. Unfortunately, we're even more. So now that I-185 has failed and Medicaid expansion is between negotiation between the legislature and yourself, what should Montanans brace for?
Well, I think Montanans shouldn't, hopefully not brace for, but recognize, like, we're on day 2 of a 90-day session. And what happens over this 90 days, whether we make sure we walk out with a sustainable budget that ultimately funds the services that Montanans expect and leaves money in the bank, will be decided over the next 88 days. If we decide somehow that, oh, this program, that 3 out of every 5 businesses in our state are relying on, at least in part, to provide health care. If we decide that we're not going to reauthorize that, well, then there will be real impacts to local governments. I mean, don't forget, but this isn't just about 95,000 Montanans. This is about not losing a rural hospital. This is about the economic impact, but it's also about the businesses, large and small, in our state that are relying on Medicaid to provide some of the health care. So I said to Mako, absolutely correct, that this could be a challenging session without it, but I'm also confident that folks recognize that we don't want to take 3 steps back. And I think this report underscores not just what we would do in taking steps back for the doctors and the healthcare community and the 95,000 Montanans, but also on the businesses in every corner of the state.
Governor, have you been personally lobbying or making appeals to specific business groups to get behind Medicaid expansion? I go through Target and I talk to people. I've gone, I've talked with local chambers of commerce, talked about how important that and other issues are in Montana. I've been talking to folks large and small. One of the reasons why I wanted to make sure that this report was rolled out today is that the Montana Chamber Days is going on, so I'll have be at their closing banquet. I wanted to talk to them about how important this is to their members, because it's actually what's providing health care for a whole bunch of their members.
Governor, what would you like the Health Link program to look like coming out of this session? What changes or improvements would you like to see?
Well, that's where, it would be nice to turn around and say that, and I put funding in a base budget. Recognize that other states have actually said, how did Montana do that? How did we get the greatest increase, indeed the only increase in labor workforce participation? Louisiana is an example. It's trying to say, let's learn from what Montana did. So I think the best way to do, if you look at what the Help Link program does, is it both has a reach out to folks, but then it also tries to address some of the barriers that individuals might have toward further employment or different jobs. So further investment in the Department of Labor Industry Help Link program would be a good start.
So is it mostly financial at this point, no changes to what the program does or how it works or what's required versus voluntary?
Walking into
day two, no, but more than happy to hear everybody's ideas from the perspective of the best way that we can make this most efficacious or effective. But what we shouldn't be doing is like putting in requirements that other states have found actually cost more. It's a punitive monitoring system than it is to actually provide the benefits.
So in terms of the people whose ideas you're willing to hear, both Republicans and Democrats, who are you talking to or working with right now in terms of lawmakers on?
Day two. So, I'd love to say by day 7 this will be all wrapped up. Well, and candidly, it'd be great in as much as we got a lot of heavy lifting to do this legislative session. And unlike when we got the HELP Act passed in 2015, you had dang near half the body, all Republicans, though, saying this would be horrible for our state. I don't hear that anymore. I hear actually maybe we should make some adjustments to it, but it's important for our economy. It's important for those individuals. And what this report underscores, it's also dang important for our businesses. So the idea that maybe this is one of the things that we should work hard and work together on and try to get it done before date 89 would probably make everybody's lives, not just those that gather for this legislative session, but those that are relying on healthcare and those businesses that have expectations that their employees will continue to have healthcare through Medicaid expansion. If we could get that done early in the session, it'd clear the way to get a lot of other stuff done.
Do you think that what happened with the House rules and the apparent sort of deal that's been struck there, do you think that makes that an easier path? Or?
I guess 2 things. One of which is I've never weighed in on leadership elections, and I've never weighed in on how the bodies should structure the rules, because the great thing about these 3 different branches of government. And I haven't really dug in enough to see what the rule changes are and how that'll impact. But it ought not, when 3 out of 5 businesses are relying on Medicaid expansion, this ought not be about, I don't care what the rules are. It ought to be about making sure that we continue this in a way that is both, it continues to work for Montana and builds off the successes we've had. Anything else?
Governor, what steps are being taken to address the needs and the obstacles in Montana's Indian country?
Ian, you want to unpack that suitcase? I mean, well,
as it relates to Medicaid.
Yeah, we can talk about, as but one example, like if we lost Medicaid expansion, the impact to our Native Americans, which is 7% of our population, would be substantial, because it also not only helps on the individual level, but when IHS runs out of money. If you think about, of the 95,417 or whatever it is, which is now sort of plateaued out, 9,500 of them are veterans and their families. I mean, we know 7 out of 10 are working. I mean, the impacts are substantial for everyone. But there's also, we could do some talk about sort of the work both in the budget and otherwise for our tribal nations. Last chance? Yes, ma'am.
Could you
Oh,
address
no, once the legislature starts. Please.
Could you address a little bit, the Affordable Care Act on the federal level didn't cover people between 100 and 138% of poverty on the exchanges. So this was the solution that was offered to states, was it not? And enables people to climb out of poverty without losing their health care. Isn't that the whole point?
And I think the whole point's even larger than that. I mean, we were the only state in the country that got both premiums and co-pays done, right? So that, and there literally is skin in the game by the individual participants. They're paying for part of this. And we have been able to afford the opportunities for people to climb through the Help Link program. So it really is that, we know, like in the accommodations and food services, 9 out of 10 businesses are at least in part also relying
on this program to provide health care for their citizens. So it is something that, it's not just hospitals or docs that need, or the 95,000 Montanans. I think it's something that we all need. I certainly appreciate you coming out. Best of luck for the legislators. Look forward to working with all of you, and look forward to seeing the rest of you around the halls and in the office. Thanks so much.